as healthcare costs push millions into poverty. India is fighting back with bold reforms. Through the flagship Ayushman Bharat scheme, India is breaking financial barriers to critical care. Jan Aushadhi Kendras are making treatment affordable. Rural healthcare infra is in focus as the national health mission takes off. Yet challenges remain: awareness gaps, uneven access, and infra limitations. Success lies in combining insurance, infrastructure, and technology, the triple foundation of universal care. As Ayushman Bharat expands, it carries a promise: no one should suffer from lack of treatment funds. This is India's prescription for health justice.
Our session today, this evening, will delve on the realities of affordable and accessible healthcare. It is widely now predicted that the healthcare market in India will hit $10 billion by 2025, which is this year. While the market is expanding at a very fast clip, are people happy paying through their pockets? Are they getting the kind of cover they need? The insurance penetration, especially in the health sector, remains relatively low. At the same time, it is undergoing a transformation when it comes to technology, when it comes to advances in robotics, remote healthcare, so on and so forth. I want to make this a very comprehensive, inclusive discussion, and along with me to do justice to it will be my colleague Rakesh.
Hi everybody, most welcome. Thank you for coming over and joining us on this What India Thinks Today panel on the most important topic, I guess, affordability and access in the healthcare. Over to you, Shweta.
Thank you, Rakesh. Let me quickly introduce all the panelists for today. On my right is Upasana Arora, Managing Director, Yashoda Group of Hospitals. Also joining us is Dr. Taran Krishna, Managing Director, Cancer Healers Center. With us is Deepak Sani, founder, Healthians. If I can locate Deepak, Deepak, there he is. Dr. Pratap Chauhan is also with us. Dr. Gridhar Gyani is with us. Dr. Gridhar? Not here. Also with us is Dr. Rajat Bajaj. Dr. Anjali Aneja is with us. Dr. Harinder Tandon is with us. Not there. And Dr. Hemant Madan. Did I miss out on anybody? Yes, sir. Can I have your name, please?
Oh, you just got it.
Hemant Madan. Thank you. All right. Yes, sir.
I'm Dr. Panda. I'm a medical oncologist at Apollo, I think.
Dr. Panda. All of you, thank you very much for taking time out today and for joining us. Let me kick this off with a very important question, and that is, every time, as I mentioned, we talk about healthcare, I know, for the fear of offending all the doctors that I'm surrounded with, I know that the med tech, health tech sector is expanding at a very fast clip. But every time I talk to a patient, every time I talk to somebody who's trying to seek healthcare, one of the questions that continue to hound them is whether they will be able to cover it with the money they make, because as I mentioned, there's not enough penetration of health insurance. At the same time, health inflation is on the rise, and that continues to burn a hole in people's pockets. So while on one hand, healthcare sector is expanding, it's also likely getting more inaccessible and more distant. I want to come to you, Upasana, first. Talk us through what changes in the last decade or so has the healthcare sector really been through when it comes to making healthcare more affordable? Apart from all the government scheme and conversations around Ayushman Bharat, what changes have you seen?
Thank you so much for giving me this opportunity. And because we are into healthcare from last 35 years, so I am seeing all these changes regularly. And best part is this, that now healthcare is quite modern because of robotics, because of different kind of telemedicine, and all the machinery which is coming to now in healthcare, everything is now fully prepared with AI. So in this way, you are like, if I talk about AI, so in radiology, you can say, now I don't know how much they are right, but all the companies are claiming that their machine can, with algorithm, they can make your reports. There is no need of all the time doctors should sit there for, just for example, X-ray and other things. But what I feel, nothing can take a role of a doctor, which will always be there. So biggest change in healthcare is lots of technology. And it's a digital health, like we are also making our hospital digital. What is digital, if you ask me, that patient can register themselves from home and then they can get their reports from there and something. But there is one thing which is, I am really worried, and I don't know, my colleagues will be agree with me or not. These days you can see lots of private equities in healthcare. America is putting all his money in Indian healthcare. Why it is so? It's a big question mark. Nobody is right now taking it
What are you
seriously.
making of it? What are you making of it? Why do you think it's happening?
It is happening after some time. You will see that in healthcare market, we are talking about affordability and quality care. And for that, already government has launched this scheme of Ayushman Bharat. We are part of Ayushman Bharat. We are part of TB Mukt Bharat. We are part of ABDM. But corporates are not coming up and they are not taking it. So after some time, you will see if next decade, you will find that Indian healthcare is not affordable at all. Because when somebody is putting money, they will, what they want profit only. So I think our USP is, if we talk about medical value travel, that if you come to India, you will get all the best treatment, because we are providing holistic healing. Me and Dr. Pratap Chauhan is working together as a, for providing patient proper, holistic healing.
Okay.
After medical science, they can go to Ayurveda. If they are coming to Ayurveda, they need some intervention from medical, our institute. So we are working like this hand in hand. And this is the USP of India, and that is what we are attracting other people from different countries that come to our place. We are very affordable. We are very Atithi Devo Bhava. We are very, good host, everything. And most important thing, I never use this word cheap, that we are cheap. We should not say that we are cheap. We are affordable, we can say.
Okay.
But
I understand.
It is
Yes.
not going to be affordable after 1 decade.
So you are suggesting with the kind of private money, private equity money flowing in, healthcare is not going to be cheaper in the next 1 decade,
It
right?
begs the question, Shweta, that, are we assuming that the healthcare today is not profitable?
If you see,
Extremely profitable.
Extremely
In fact,
profitable.
let's take that question
please,
to Dr.
Yeah.
Taran Krishna. I think one of the grouses of every person who's ever had to see a doctor would be that it's become very, very tricky if you fall sick when you don't have enough money to cover for your treatment.
So there are two things. First, if actually I would say there are two kinds of people in India. A, who are being sponsored by a corporate, where their insurance are being funded by that corporate agencies, and they have to just show in their insurance card, they go to a hospital and get their treatment done. Then there is another India who have money, but they do not have an insurance. They have not taken the wisdom of getting insurance done. They have the money, but what they do is they go to a hospital, pay cash, and get the treatment done. Now, when you say affordable, the way GDP is rising, the way things are rising, the way things are being introduced, India, I love what Upasana ji said is, why should we call that India is having a cheap treatment? वो cheapness, वो छोटा सोचना, वो कम सोचना, अपने आप को inferior दिखाना, I think that has to go away with healthcare. Healthcare is all about the best of technologies. Talent is costly. Cheap talent is something which can be dangerous for any hospital healthcare. Likewise, if you have to have the best of doctors in a hospital, you need to pay them good so that you get the best of talent for your hospital. Right? And if they're suggesting any treatment to any of the patients, I would say free can be dangerous, cheap can be dangerous for a patient, right? Second thing is, if there are two kinds of...
The need, can one of you please switch off your mics, please? I don't think the conversation Okay, I don't think the conversation is about making it cheap so much as making it affordable. I think it's important that we draw a line between the two. We are hoping that a majority of Indians should be able to get the necessary health checkups, healthcare. Their needs should be met without having to pay out of their pockets and without it having to burn a hole in their pockets. So I understand that there is a firm distinction between the two.
So Shweta, what is happening is people are actually investing in healthcare once they have been sick, when they've been diagnosed as sick. Problem is that they're not investing when they are well. They're not getting their regular checkups done. Had they been doing their regular checkups, probably what you're talking about is affordable healthcare. What you're talking about is getting their treatments done, and which is costly in a hospital. That is costly in a hospital because, see, I'm into cancer treatment. And when patients come to us, most of them are in stage 4. And in stage 4, where the disease is already spread to liver, lungs, bones, and brain. And then you expect that they should get that primary health treatment which is affordable to a patient, where the disease is already spread? No. I'm sorry, that cannot be possible.
Most of these cases, is it because the patient didn't come to you to begin with, or they were not deduced, with the stages of the cancer that they were in to be able to get that sort of help?
They are not aware that they need to do regular checkups. Abhi, if I ask you a general question in this hall, except the doctors, if I ask any non-doctor, any non-medical, how frequently they do their health checkups? Yesterday, I got a call from one of my friends who said that, she just called me and she said that her father got diagnosed with cancer. When I asked, when did you get your last PSA done? She said 1.5 years back. Now, at 67 years of age, who is doing very well in the business, one of the top builders in the country, and getting a health test done after 1.5 years. I mean, that's the awareness that is lacking in India.
Absolutely. I mean, nobody can debate that. I want to quickly get in Deepak Sahni because I think he's the person who spearheads preventive healthcare. And I think one of the grouses of doctors is if you come to us a bit too late in the day, it becomes very difficult for us to be able to give you the sort of treatment that you require and make it affordable at the same time. Do you think there's been some sort of a shift in the approach of people around you? Because I remember speaking to you about a couple of months back, and you said people are now more and more seeking preventive healthcare as opposed to what they did prior to 2020, prior to COVID.
Yeah, you're absolutely right. I think I'll just take a step back and basically because we are talking about the healthcare getting expensive, the first thing we have to understand, it's a supply and demand gap also, right? We are talking about 1,100 beds for one patient, 1,100 patients for one bed, 1,100 doctors for one patient. We're talking about a huge gap, and whichever country has tried to make it more accessible or are driven by insurance or by government, I think all of them are struggling. We have NHS as one example. We see American healthcare failing. You cannot give healthcare for free. That's very, very clear because the country cannot afford that. We're talking about 100 million diabetic patients by 2035 in India, and just that cannot be affordable. So I think we have to also understand the only way to protect that or to actually deal with that is preventive. How can you actually, like he rightly said, how can you actually detect the disease much earlier? We've seen the trend change. COVID has changed a lot of stuff. I would probably say just in the last 1 year, we have seen a 23% increase in people taking a preventive test in just the January month this year, right? And I always see January because the new year comes and people take new resolutions, right? So just that 23% increase. And if you look at awareness definitely is all-time high. Specifically, all of us sitting here, probably you just tell them they will order a black coffee or a green tea, but they will not go for a normal sugar tea. And that's the kind of an awareness change that is happening. So people are getting aware, they are counting their steps, they are doing something about the health. The awareness is there.
But not getting the checkups.
Yeah, but the checkup is the thing which is not happening still, right? It could be a fear of getting a needle in, it could be a fear of anything, or the largest fear that I have seen in my service is fear of getting detected. And that is the largest fear people have. They don't want to get detected. They don't want to change their lifestyle after getting detected. So you smoke as many as cigarettes you want, but you won't check because you don't want to stop smoking. So that's the issue.
There's a challenge, even at the level of preventive healthcare, it's not a free run, you have to pay for it. So if, given everybody in this room can probably afford a health checkup, twice over, thrice over in a year, or do a quarterly one, but we're talking about a larger population of this country. For them, the basic challenges, given the per capita income that we have, is to manage that preventive health checkup. And that itself is, going through the medical inflation, the term that you used, You brought in some innovations, some tech aggregators have brought in some innovations. But if that is the remedy, then, that has to be incentivized at the most. What are some dramatic ideas in terms of incentivizing health checkups at an early stage so that we don't end up in a situation where there is no solution and it's a big fiscal mess, apart from being a physical mess?
Dr. Madan, just to introduce myself again, I work for Narayana Health. Shweta, I just want to turn your question on its head. See what's happening in society these days, and as reflected by the first statement you made that you're surrounded by doctors. We are not going to hound you for sure. The attitude that needs to change is by accepting that healthcare and personal health does not figure in the list of priorities for our citizens as at large. Many of us feel that healthcare has to be relegated to a lower priority as compared to our children's education, as compared to buying a car, as compared to wedding, getting our daughters married, and so on and so forth. I also want to challenge you a bit on, when you say that healthcare has gone up significantly, healthcare cost has gone up significantly. I want to ask you, as compared to what? As compared to the cost
As compared to 5 years ago, perhaps?
No. Healthcare compared to healthcare, or healthcare compared to other commodities, or healthcare in India compared to healthcare abroad? Now, these are different. Let me just complete. These are different parameters. For example, a big event like, say, a wedding in an Indian family, when I got married, cost about 3 lakhs or 4 lakh rupees. Now it's 3 crores on an average for people of our strata, or maybe not 3 crores, but at least 1 crore. Has bypass surgery, which is an equally big, if not a bigger event, gone up by the same parameter? So there is an inflation, I agree, but please don't compare inflation in terms of perceptive terms. Let's compare it in terms of actual terms. Now let's compare India versus abroad. Would you ever envisage what a bypass surgery? I'm a cardiologist, so I'll talk about bypass surgery. I'm sure Tarang started off very well and brought this up. Bypass surgery in US, what would it cost? In Europe, what would it cost? In Singapore, what would it cost? So, let's not trivialize healthcare. And I take a lot of communication skills workshops for many people across the strata. I ask them that when your child turns 17 or 18, you give him a good cell phone. How many Indians have ever gifted an 18-year-old child a health insurance policy? Has a father ever gifted a healthcare insurance policy to his daughter and said, "Beta, jab tak, till you're alive, I'll fund 5,000 rupees per year, every year for your health insurance"? It doesn't rank in our priorities. And therefore, even the richest of people, when they are asked to spend a bit on their healthcare, they squirm. So I'm not saying it's cheap, but I won't agree that it's over the top expensive. So, let me just complete. I know it's a bit long. I won't speak after this.
No, please go ahead.
There is a governmental mandate. When a car is driven out of a showroom, there's a government mandate that it must have an insurance, right? How many? What can be done for us to have a similar mandate as a health insurance? Let's insure our health, and so that we don't feel the pinch. So there are lots of perceptional problems in this question.
I have two follow-up questions from you. So when I say medical inflation at double digit today, 14%, way higher than national inflation, the CPI, consumer inflation in India, I don't make that figure. That's a figure that is collected put together by the government. So I'm not sure if you would like to contest certain parts of it, but at the same time, would you agree that inflation, when compared in India, medical inflation has gone up significantly? Part number one. Part number two is, when you compare India to other developed countries, are you not taking into account their per capita income versus our per capita income? If citizenry there can afford a bypass surgery, which is at a far higher cost to India, because our citizens honestly cannot afford it.
Okay.
If I may add, first and foremost, the idea is not to put you in the dock. The idea is to look at solutions. So I was a little, so to say, scared when I saw so many doctors around me with Shweta.
You don't have
we
to
assume we are healthy, and we don't want you to be unhealthy either. So the idea, I just
Rakesh,
add to that question. So there are independent studies on the macroeconomy dealing with healthcare, both by Delhi University, IIT Delhi, which have found out, I don't know how recent it is, but there are empirical studies done over the years. If someone is in lower middle class, he turns poor. If someone is poor, he's pawned. If someone is upper middle class, he turns lower middle class. The rich don't care, and that's a very small percentage. That is the impact of rising healthcare in this country.
True.
Pardon my being a little frank, I think comparisons with global, per capita earning economies like Singapore and US wouldn't fit in here. And I agree with you, in terms of education, we don't gift healthcare policies to our children, even if we can afford to do that at some stage of life. We have to look at it's a very complex issue, I agree with you, Dr. Madan, but we'll have to find ways to get out of this fact. But medical care in India for 90% of Indians is not affordable.
I think I agree with Dr. Madan, like if you are talking about affordable healthcare, why can't we talk about affordable insurance to everyone?
Absolutely.
That should be the bottom line.
Actually, your chairman, we had a chat with him on one of our shows, Duologue, where he mentioned insurance is the panacea.
Yes.
Is everybody in agreement on that being the single most potent solution to dealing with affordability as a challenge in the medical care sector?
Affordable. And second thing, if you look into it, we are not that bad also. You are saying in last 5 years, the healthcare there's shown an inflation. But if you look into even the aviation industry, 5 years before the COVID, the cost of traveling to one country to another country, I think that has almost gone up by 100%. It's not that, I don't think so, even the healthcare has gone up by 100%. The second most important thing is everybody should be able to afford healthcare, but with an affordable insurance. That is the bottom line. Second comes your, what you say is awareness. If you're aware, only then you go for a health checkup. And, he says his preventive health checkup gone up by 23%. The new year resolutions are important, that is there. But the second most is, most of the people, corporate people, their policies, their everything finishes by 31st March. So they try to do their health checkup by 31st March, not in whole of the year. Second, we are not that bad also. We look into urban sector, we look into the rural population. If I'm a gynecologist, and I must tell you, look, with a lot of hard work, and by our maternal mortality rate has gone down by 100 per 100,000 live births, and we have achieved our targets. It has gone down by 83%, which is much, much more than the other countries in the world. Why? Because everybody is, the government hospitals, the government of India, and even the private sector, they're all working together. So if we work together, everything is achievable. But why the awareness, Why the maternal mortality has gone down? By the awareness, correction of anemia, and institutional delivery. Everybody is focusing on the delivery in a hospital. That is the reason it has gone down. So even if you look into cancer, you say, in 1992, the cervical cancer in UK was brought down by 90%. Why? There was a reason, because every woman was screened. And after every 3 years, there was a call-recall system that you are due for your checkup. And they make sure that you go back and do the checkup, which being urban population, it's number 2 cancer in our country. Otherwise, it's number 1 cancer of our country. We are still not able to bring it down, because if we have just simple system, call and recall, we can bring it down. That is awareness. If we can bring our MMR, we can bring down other cancers also. So I think insurance is the key answer for an affordable healthcare.
Thank you, Dr. Aneja. Yes, Dr. Panda.
Yeah. Sorry, I think I have to be a dissenting voice. The per capita income, last I checked, is $2,940 per year. If affordable healthcare insurance would have been the panacea, look at USA. I've spent some time there. Half of the black people are actually turning themselves in the emergency so they can have to. What insurance covers nowadays, even with Ayushman Bharat, is 5 lakhs. In a corporate hospital, that might not stand for 5 years. In the last, I'm as a medical student, I've been a part of the government education system, studied on a scholarship in a government school, studied on a scholarship in a government medical college, went up to All India Institute and Harvard. So I have some strong word to say. In a country like India, where 95% people don't pay tax or don't have the means to pay tax, if you are looking insurance as a solution, it is unfair, unjust. Tagore, about 150 years back, wrote a poem called Humiliated. Jare tumi phelicho paschate, she tomare tani beje niche. If you are putting a group of people behind, they will pull you down. In such an heterogeneous population, madam, you cannot ignore government system. We have all have been treated. Now things are happening. In Delhi, you have everything in an ivory tower. Go 100 kilometers away to Amroha, to Muzaffarnagar. You are not, people are doing a biopsy, are not doing a biopsy. So what are we talking about? What sort of, only putting a quantity price tag on something doesn't give you a quality. No, let me finish just 2-3 points. The rot starts from a very beginning. In a midday meal program, we are spending 7 rupees. And sir is right, we are glad to buy good quality clothes but for nutrition we don't have. It is a perception. Well, insurance is important, but it cannot be a panacea. My word is, it cannot be a solution for all. By strengthening government infrastructure from primary healthcare to tertiary healthcare, and especially in primary and secondary healthcare, only then you can. Because the private sector looks at a return on investment. In primary healthcare and primary education, there is no return on investment. I mean, you don't see the return on investment. So unless and until government spends money. Professor D.P. Kothari, when a Kothari Commission says 6% of the gross national income in 50 years couldn't happen. Professor Kothari was a proud student of Professor Meghnad Saha, who started this planning commission, everything, had a far-fight vision. And China has gone ahead, not because they are something, because they started putting money on their primary education, secondary education, primary healthcare, and secondary healthcare 50 years before us. So, well, insurance can be one solution, but it cannot be only solution. Another thing we are looking at, the number of doctors has, in last 20, 30 years has increased. That is a quantity. Since if you have an idea about research, you know that qualitative research is much more difficult because you cannot put a tag on quality. Similarly, you can calculate number of medical colleges opened, you can calculate number of medical college buildings opened, you can say so many of doctors are coming out. What is the quality of doctors? Who is editing? Have you looked at if the quality is actually being at par, is it going down? So these are the tough questions. I have no problem with insurance. I believe everyone should have some insurance and government is doing. But insurance cannot be a panacea. It cannot be the only thing for that.
Something needs to be started somewhere, you know.
Right.
It's not that we say that we all know that everybody is not paying the
by
tax.
pushing to insurance only,
No,
we are
start something.
systematically
Sorry, if we
degrading.
can one after the other, please.
We can't go by what is the quality of a doctor. This is a absolutely going to be a different forum, you know.
No, but
at least start with something, add on something, and you know, at least take something forward.
My only point, ma'am, that government health infrastructure, which has been systematically becoming weaker because of lack of funds.
In our obs and gynae, we have definitely seen the change.
I see the doctors here are very charged, but I think it's a good conversation to have to begin with. Dr. Chauhan, yes, I think you're somebody who is frequent in media. You speak a lot about affordability of healthcare. You know, what are your thoughts on where we are as far as primary healthcare centers is concerned? Reports suggest that about 30% of PHCs have intermittent electricity. So I'm not even talking about how good they are, how beautiful, wonderful their infrastructure is. I'm talking about electricity, must needed for a medical setup to operate. 30% of them have intermittent electricity.
So thank you very much. First of all, my background is Ayurveda. So I think we have a wonderful, affordable healthcare system in India, which we are not looking at. Of course, with all due respect to insurance and infrastructure is needed to be definitely, a lot of things can be done if we improve our, primary healthcare, and not only that, awareness is so important. And after that, are we talking about healthcare or are we talking about disease care? Healthcare, if you talk, then we have so much of the, Ayurvedic knowledge where we can, even you don't need to really go for things like, all those expensive treatments, And if you look at the scenario in the world today, I traveled to around 40 countries, so many people are now adopting yoga, meditation, and, all these home remedies. People are really caring about their health. So I think basic thing is education is so important. And then we have to definitely improve the infrastructure, which is government infrastructure, which is available there. They have to be educated. I think that's the only solution. If people will come to private hospital, then definitely, private hospital works on a very different model. Another model, as Dr. Upasana just mentioned also, that integrative medicine is going to play a very important role, which can be, because once the patient comes to the disease care, and once the medicine disease has been, taken care, then they should be, pushed down to more health, oriented things like food, lifestyle. Today we are talking about the biggest burden on our population is the lifestyle disorders. So if wrong lifestyle is the cause of your disease, why don't we fix the lifestyle rather than we were going for all these expensive treatments? And we have started quite a few initiatives like that with lifestyle disorders, and we are getting wonderful results. So I think Ayurveda has the potential, which is not like just like I'm saying just because I'm from Ayurveda. If you look at the Chinese model again, they do the same thing. There's so much integration they are doing with traditional Chinese medicine and modern medicine. Every hospital has a traditional medical center, and they work together, and they brought down their healthcare, costs using the traditional medicine.
I think, Rakesh, I think an important conversation in all of this is also preventive healthcare. I believe I will request Deepak Sahni to come in just a bit, because I think he comes in there when it comes to preventive healthcare. India is also dealing with an obesity problem. Data suggests about 70 million obese people in this country as a result of lifestyle challenges. All of us, as a matter of fact, you and I have some of these issues because we just don't get to walk enough. We don't get to go out of our offices enough.
I think that one of the solutions that's being mentioned here is integrated healthcare, which is most welcome. But we are in a situation today where we are number one in most of the diseases. So, the problem is right in our face. Preventive for a population that's shaping up, great idea. Preventive, but those who are already in the grip of the disease, whether it is diabetes, whether it is cancer, whether it is obesity, whether it is mental health, it's an overarching challenge we have. The numbers are, the numbers are extremely alarming. All of you would know it better than me because you're doctors, you're dealing with them. But preventive is a great idea to initiate among our Indian youth, which is our strength, to preserve that strength. It's a great idea. I was going to talk about in terms of solutions. Let's just look at solutions.
Absolutely.
Insurance is one solution where I think there's a broad consensus that it is not an ultimate panacea, but it's one of the solutions.
Let's get Dr. Rajat Bajaj also into this conversation as we talk about solutions.
So I think I agree with everybody that the insurances have to be there. I think the insurances can be incentivized as well. Like, somebody said that if we have a car out of a showroom and there has to be an insurance attached to it, then why not for, somebody who's more than 18? I think we should be doing that. Certainly that is one thing. We are talking about the immunizations, we're talking about the vaccinations. So if you talk about the preventive part of it, the Indian government has actually incorporated the cervical vaccine into the immunization schedule. So that is a big welcome. I'm an oncologist, so I would certainly welcome that part. Also, the cost has been brought down because initially we had only the foreign companies coming in. Also the affordability, of course, there are a lot of people who are talking about affordability not being there so much, but then we have known that a simple cancer like a breast cancer has a medicine called trastuzumab, which used to be very costly when it came into the Indian space maybe like 20 years back. Now we have just like maybe 1/15 of that cost available in India. So certainly things are being helmed in that direction, I would say. But still there is a lot of ground that needs to be covered. Patients or people in general, in the general state of the society, have to be made aware that prevention is always better than cure. We all doctors actually emphasize that the preventive oncology is also one part of it. I'm a cancer specialist, so I would say that way. And then, like you said, that it doesn't take much out of your pocket to actually run these preventive tests, and there are a lot of companies which are helping us in that regard. So literacy, more awareness, more media campaigns have to be there so that these can be adopted. And not only we should be focusing or spending on luxury, but these are equally important measures that one should be taking care.
All right, let's also take this conversation to Dr. Harvind Tandon, who's also with us. Dr. Tandon, I think you heard all your panelists, and obviously, there is agreement, then there is also disagreement on who should bear the burden of that insurance. Should we put it on people to pay up the money, or should government partake and respond to people's need? We know that public institutions are overwhelmed. Today, and it's very unfortunate, some of the hospitals that I go to, they've become hotels, right? 5-star, 7-star, and the prices are same. So I think, speaking from a perspective of a common man, a middle-class man, as my colleague Rakesh pointed out, every time there is a medical emergency, it makes somebody a little poorer, following that on medical emergency and getting the right sort of treatment. This is a problem that needs an urgent solution.
Shweta, I'm an orthopedic surgeon, and what Tarang had said, I really agree with him. We actually have very two diverse populations in this country. Now you are talking about the 7-star or 5-star facility. You have a percentage who have to take that care. So you need, those people are fully covered. But for the majority, you need to think out of the box. Just like Dr. Bajaj said, you have to find solutions out of the box. One of them was Ayushman. It was never thought of that there will be a government scheme. Ayurveda definitely has to come in. I'm an orthopedic surgeon. I see so much of bone problem, whereas our country has sunlight throughout the year. So the media has to help the doctors to break some myths which are going wrong and sort of get all these things, all acts together, that please start yoga, getting sunlight is simple, essential. All the other things which you mentioned, obesity, other lifestyle problems, they can be addressed. So we have to find solutions ourselves for our set of problems.
Okay, I think let's quickly check with the audience. How many of you actually managed to get about 15 to 20 minutes of sunlight every day in the morning? And I think, Doctor, the peak hour would be about 10 o'clock in the morning, or 10 or 11?
The best time of sunlight is between 10 and 12.
Between 10 and 12.
Most of the working people are indoors.
Absolutely.
Most of are in artificial
Raise your
light.
hands if you get to be in the sun between 10 and 12.
Shweta, I'll put a question to all of you.
That's only doctors raising their hands.
How much of skin area you will expose for sunlight?
That's a good one as well.
Some data point for you, it's like 76% people are deficient on vitamin D is the data.
So in a country which is abundant with sunshine, we are deficient on vitamin D. That it shouldn't come as a surprise.
And we have research now to support us that vitamin D was called the healthy hormone, right? So it does not only affect the bone, it affects your mind, it affects cancer, it affects everywhere. So you fix simple things which suit your country, your population. You have to think that way. We can't get the Western model into our setups. And primary health, what Panja said, very, very important. We need to invest into the primary health and prevention.
primary health and prevention, and there you have it, a doctor telling you to go out and sit in the sun. I think it's more beneficial than taking perhaps a lot of other hormonal medicines. It's going to be more helpful for mood elevation, I believe. That's something I also read. I want to...
Just an addition, with no sunblock on your body.
With no sunblock. All right, Deepak Sani, the last I met you, you gave me some fascinating insights into people's health and lifestyle and their choices and why. And I remember, I think it was you who told me that people in India, those who have alcohol, consume alcohol, especially in Delhi NCR, are more likely to have fatty liver as opposed to Western countries, I believe?
Yeah, I think, yes. So that's the lifestyle that probably challenges that, because we like to eat food with alcohol, right? And a lot of food after alcohol as well. And that's what basically, because alcohol is anyways not good, but with the food, it is further adding up a lot of fat and a lot of issues. And that's what we see. And the trends, like I explained last time also, suddenly I've seen the anemia patients rising and the numbers are just increasing. There is no absorption of iron at all. And that has been changed in the last 5 years, right? So that's again becoming another vitamin D issue.
And why is that?
I think the doctors would be able to comment better there, but what we have seen specifically is the environment, the pollution, the lifestyle again, and a lot of other factors that basically stops the absorption. And this is the trend. And in fact, that's where the health data starts to play in, because before it become another vitamin D issue, we need to do something here, right?
Why the people basically, it's awareness. Why anemia is increasing? We are working a lot on that. It's basically they are not eating right. We are all very fond of eating palak paneer. Ideally, palak should not be eaten with paneer because your calcium is not going to absorb it. It has to be, and there is a lot of worm infestation in our people, in children, So that is the anemia. So now even the government of India and all the obstetricians, they are working very hard. There's a program called Anemia Mukt Bharat, where the anemia has gone up, and now that they have seen, they are correcting anemia with iron, but they have forgotten most of the Indians are vegetarian. They are B12 deficient also. So either your intake, what we are eating is not correct. We don't know what is right. So with
then what's correct? I mean, it's surprising for me. Palak should not be eaten with paneer.
Yes, because it has phytates.
So food for thought there for all of you. But
old people, lohe ki kadhai mein khana banao. Okay? Anything which is rich in iron, put little lemon into it.
Traditional wisdom.
So that's a better. Good chana. You remember your dadi, nani used to give you good chana? That you need an iron also. You need a protein also to transfer your heme. So these little things sometime, even for a doctor also, it's eye-opener, because we have also forgotten when we have read our physiology and our biochemistry. So it's going back and learning all
Shweta, can I ask everybody sitting here?
Yes, sir. Please go ahead.
Bhindi is rich for what? Bhindi. Lady finger. It's one of the richest sources of calcium.
There you have it. Calcium deficient people
So
should
like-
eat more
like
bhindi.
It's well consumed, I guess.
It is well consumed. Yes.
जो तिल हमारी कल्चर में है, in all parts of India, til is used in some or the other ceremony.
I wanted to take this affordability from a business perspective. We have companies like Healthians who have changed, brought in competition. There were only a couple of players earlier. Now there are more players. Tata has also got into it. That's welcome. But why can't we do a Jan Aushadhi template in preventive health care from the private sector, not from the...
गायनी में इतना available है. Problem मैं यही बता रही हूँ, awareness नहीं है. Even we as a gynecologist are also not aware of it. So everything is there. That is the reason there is so much of work is going on it. I don't know, anybody knows here also, that there is a deworming days given by the government of India, 10th February and 10th August. Even
No, I was asking about, like Jan Aushadhi has brought down prices dramatically for all major diseases.
But you know what the problem is? Log sochte hain ki whatever is available in government is not a good thing.
That the data doesn't support that. The Government of India data doesn't support that.
That has
Government
to be...
of India data is saying that there's a greater proclivity now to go for Jan Aushadhi medicine.
So
So that's a
has to be
welcome thing.
integrated in the
No, my
mind of a
question
common
was,
man.
why can't we
Ki
do
it's a
that
good drug.
why can't we do a similar template from the private sector in the preventive health care? That's where the problem began, where you said it.
Very, very good question.
Yeah.
Why
I think
can't we
we
have
need
something
to-
around private, from private sector coming in? on the likes of Jan Aushadhi Kendra.
Yeah.
And if that happens, I believe there'll be a lot many takers.
Yeah, I think we need some innovation there, because if we start incentivizing, supposingly we say, if you improve your health, your insurance premium go down, right? That's not there today. So I pay the same insurance premium even if I don't take a claim, but I pay 20% less if I don't take a claim on my car, right? So what is my incentive for becoming better every day? Or rather than shifting the model from healthcare to self-care, right? So that sort of a model probably tells people that there is an incentive. Supposingly we talked about cancer, so I was talking to a bigger program of cancer, and we say, we will afford your cancer treatment, and there is a $1 billion fund working on that. They just said that, but you have to screen yourself mandatory every year and send us the reports. So if you don't screen yourself every year, we won't be able to support your treatment, but we can only support your treatment if you screen and give your report to us every year.
So that's
because
like
that can actually, so that $1 billion fund can actually take care of all the people to actually get treated, because a lot can be done, because the earlier you detect, the cost of cancer, he can comment that, is lower.
Right.
And the later you detect, the cost is higher.
We've run out of time.
But I must tell you, everything is, if we are talking about insurance, everything is covered after you are admitted in a hospital. So for preventive health, you are not supposed to admit in a hospital because it is not right practice. Few hospitals are doing that they will admit patient with some other reason, and then patients are getting their preventive health checkup. But as you said, why private hospitals are not coming for this? Actually, I think we are doing it. We are all the time posting lots of things to that patients should aware about how to eat, what to eat, and how to prevent themselves from all this flu and then corona. And my biggest question with everybody, like I am really supporting government because they are trying to do everything, whatever is possible. If you see our previous governments, nobody has taken any interest. Now we have PSC, CSC, medical college, nursing college. What is the need that now we have to work on PPP model? A private hospital should handhold a PSC, CSC, so load should be there, not come to the quaternary or tertiary care hospitals, and we can resolve those issues.
Right.
So I think this is the answer of all these questions. We cannot, wait for patient that he has to admit, then we will give him treatment and we will get money from insurance.
Absolutely. I don't believe at any point of time it's a question of intent. I think there is enough and more intent. It's a question of implementation. And I don't necessarily agree that the previous governments have not really done enough.
No, I think healthcare has been a priority minus the government raising its spend. So in that sense, if there is a view that government should spend more and more money, I think we've been deficient on that across the board. No, Shweta, one very important point on PPP. See, in terms of affordability, one of the ideas that was floated 20 years ago, 30 years ago, was the public-private sector model. We couldn't replicate that in a big way. Why? I would like to hear from the experts. And second, wherever we've been able to do it, there are challenges now. We know, I would like to name there are challenges in terms of whether actually the quota meant for the poor and extremely poor has actually gone to the poor, or it has gone to the rich in the name of the poor. So, those are challenges. These are recent probe that has been launched by the government of India with a major hospital chain. I don't think, the key issue to raise is, if PPP model is the formula, why is it that not many such templates are happening? Dr. Tandon.
I think, Rakesh, with now the digital, the mobile, and all those networking more having penetration, pretty sure that misuse of these things won't happen if it is made really well. And some monitoring has to be done. Now, that monitoring agency will be government, or obviously the hospital side cannot do that.
Right.
So it has to be done.